Hello everybody, Dr. Mike Pfeiffer here, physical therapist and athletic trainer at Orthopedic and Balance Therapy. I hope you enjoy this video. Don't forget to subscribe to see future videos, and also give us a like and share this video if you learned anything. Hello everybody, I'm here with the amazing, smart, knowledgeable, and overall just great person, Dr. Gina Geissler. She's an audiologist and owner of Dr. Geissler's Hearing Center. Thanks for being here.
Thank you for having me. I'm excited to hopefully educate some more people about hearing and balance and, you know, what we could do for patients.
Great. So, excuse my ignorance for audiology, but until we spoke recently, really my only understanding was back when we were in school and, you know, you have the headphones on and the beeps in the ear and just, I can hear, and that's about it for audiology. So I know there's a lot more to it from what we've talked about before, but could you just tell me a little bit more about audiology and what goes into that? And I know that's just the tip of the iceberg, but everything that goes into audiology.
Well, there still is the test where patients hear beeps and they can, you know, we have them respond in different ways. It's not necessarily the old-fashioned raising their hand, but there's a lot of testing that evaluates a patient's ability to understand speech in quiet, speech in noise. You know, I see a lot of patients that will come in and say, well, I can hear my wife, but I just don't understand because she mumbles. So, you know, it's important to not just hear tones, but also be able to distinguish sounds. It's also very important to check the full ear, you know, from your ear canal, making sure it's not plugged with wax, to your eardrum, making sure you don't have an infection or fluid in your ears, to making sure your balance system is correct, in those neural pathways up to your brain are open and, you know, firing the way that they should.
Awesome. How are some of the ways that you know, not just hearing a tone or a sound or I can hear or I can't hear, but how are some of those ways that you determine how accurate that is, or, you know, if they're missing certain tones, or what goes into that?
So there's different tests you can do where they have to either repeat words or sentences, and they can be at different sound levels. You know, so sometimes when things are real loud, you know, people can score well, but then when you're at what we would potentially consider a normal conversational level, people think it's too soft. And, you know, and then it's educating them, no, this is, you know, you should be hearing at this. And sometimes I'll say, you know, how loud's your TV, or do you think your neighbors can hear your TV? Is your spouse yelling can your spouse hear it at one level and you need it 10 numbers up to hear it? You know, those are all, you know, things that can sort of be clues and go into that.
Awesome, good. So taking a step back, how did you get interested in, so you're from the area, right?
I'm from Hegewisch.
Okay, or close to the area, okay. How did you get interested in audiology, and how did you end up in Northwest Indiana from Illinois?
Well, Hegewisch is just over the border, and I went to Bishop Knoll High School in Hammond. Both my grandma and my mom both have a significant hearing loss, and growing up I always saw a lot of miscommunication, or, you know, sometimes even, like, you know, family arguments due to miscommunication, or people not being in the right place at the right time, and it was, you know, it was frustrating, and I thought, isn't there anybody that can help these people? You know, and it really affects the family, and it really affects that individual's quality of life, sometimes even their ability to work. So when I went to college, I went to Marquette University in Milwaukee. And I started studying speech pathology because I was really interested in how we learn speech and the brain works. And then I sort of fell into audiology and the hearing aspect. And you actually hear with your brain, technically, not your ears. Your ears are just the pathway to your brain. And so, you know, I just got interested. I like the one-on-one working with patients. You know, in this profession, you know, I get that, you know, get that opportunity. So I just yeah, I just think that, being able to hear and communicate with your loved ones is so important, and just from personal family experiences is sort of how I fell into it.
For sure, awesome. And I was doing a little reading on your website. Not only, you did most of your schooling in the Midwest area, I guess, but also an interesting fact is, and very, I think, inspirational to a lot of people, is you do some mission work as well.
Yes. So
yeah.
I've probably been on about 15 to 20 different mission trips. I've been to Guatemala, Mexico, Arizona, Canada, Africa, the Dominican Republic, Haiti, El Salvador, a lot of different places. Right now I'm married with 3 small children, so I'm not allowed to leave the country.
Gotcha.
But if they get a little older, they'll be getting their passports and coming with. So, hearing is something that unfortunately doesn't get the attention that it should, and especially in developing countries, a lot of kids don't get the services they need. So a lot of our volunteering is either through a school system or through a hospital system. So, follow-up can, be given to them, because if you can't hear, your chances of doing well in school are not very good, and then it just, snowballs into difficulty.
Makes sense. So speaking of kids, you work with all ages, mostly older individuals, or what age groups do you?
So I can see anybody from age 0 to 100 and whatever,
Gotcha.
100 plus. Majority of, I would say probably 60% of my patients are over the age of 50. The average age of my patient is getting younger and younger. Currently, according to statistics, the average age of a person going to an audiologist is 62.
Okay.
So, but I also see kids. I don't see them as much, but I like kids.
Good, awesome. What are some, so speaking of kids, and I think this might also relate to older individuals as well, but with younger people, not necessarily kids, but younger people, what are some ways that they can help prevent hearing loss, or basically save their hearing, or maintain their hearing so that it doesn't get bad in the future? Are there things that people can work on before it gets too late?
Yes.
Or steps to take for that?
Yes, absolutely. Hearing protection by far is so important. It's really the only thing that you can do proactively to prevent your hearing. A lot of people think, oh, well, I don't work at, the mills 8 hours a day, so, I'm not exposed to noise. But things like vacuum cleaners, snow blowers, lawn mowers, noisy toys, leaf blowers, power tools, music, all those things are wonderful, necessary. We all need to have or do those things to keep up with life, but wearing hearing protection is critical even when you're doing things like that. It's not necessarily, being exposed, going to one loud concert, or, cutting your grass one time. It's the cumulative effect of noise over, your lifetime. So an example I'll tell patients is, you can go to Florida and get a sunburn, but you probably won't get skin cancer from one sunburn. But if you're constantly getting sunburn every year and your skin isn't protected, it significantly increases, your risk. People ask me a lot of times about, all the kids with their headphones and, the cars where you can hear the music and you pull up to the stoplight. So sometimes I like to hand my business card at the stoplight. But the thing with music is, it isn't necessarily the music that kids are listening to, it's the volume at which they're listening to the music. So listening to music isn't bad for you, it's just if you're listening to it too loud, where it becomes dangerous. So just a simple rule of thumb is, if you're sitting next to someone and you can hear what they're hearing, it's too loud in their ears. Okay. If you can't hear it, it's fine. But if you can hear your neighbor's headphones, it's too loud for them.
Great, those are great points. What are some ways? So speaking of protection, Are there things that you offer here for protection, or are they just over-the-counter type, just headphones, or what ways would that, how would somebody protect their ears from, cutting the grass or something like that?
There are a lot of over-the-counter methods with, traditional muffs and, little insert ones that could either look like foam or little Christmas trees, little rubber ones. There's a variety of those. Anything is better than nothing. We do a lot of custom hearing protection. So, we can take an impression of your ear and something can be custom made. One of the complaints we'll hear is, well, I don't wear hearing protection because it doesn't fit in my ear. It doesn't stay. It's uncomfortable. Your ear canal is a very personal curvature of your body. So, getting the right fit is important, and if it's uncomfortable, people aren't going to wear it. Hearing protection can cost anywhere from $100, or, if you want real fancy, like musician in-ear monitors, things like that, it can, go up to, whatever your needs are.
Gotcha. Cool. So for those that are maybe getting a little bit closer or older in age and are starting to get some hearing loss, what kind of devices, or I'm just used to the old school big old hearing aid behind the ear, but I know we've talked about some crazy cool new technology. What is that? What are some of those things that people can do, and just the new technology out there for hearing aids or other assistive devices for hearing?
So the most important thing you can do is get a comprehensive hearing test, because that is your baseline. Because if you add enough candles to your birthday cake, you're most likely going to have some sort of hearing loss. But what we don't know is if your hearing loss progresses slow, is it progressing fast? It's kind of like going down a flight of stairs. You can take 5 big steps down, or you can take 20 baby steps down. So having a baseline is so important, because then we can see you in 5 years or 10 years, or, and say, oh, there's just been a little bit of decline, or, the first 3 years it's been the same, but now we're starting to see some decline. So having a baseline is very, very important. Even if you think your hearing is fine and you have no problems, if you are over the age of 50, I would highly recommend getting a baseline. The awesome thing is it's 2020. It is not 1970. So your big old honking beige hearing aids with your rotary volume control, that is out. So everything is, digital. You can hook hearing aids up to your cell phone. You can have disposable hearing aids that are inserted deeply in your ear canal and you wear 24 hours a day. There's so many options with hearing aids and accessories, things that you can link to your plug. You can plug in an adapter in your TV and have your TV stream wirelessly through your Bluetooth hearing aids. So the TV's like it's right in your ears. So your significant other can set the volume at whatever they like, and you can set the volume at whatever you like in your ears. Being able to control your hearing aid on your phone is a nice option. So if you're sitting in a restaurant or church, or you're at a family party and there's a lot of noise and you want to alter the way the hearing aid is adjusting to that environment that you're in, you can open an app on your smartphone and adjust it so you're not sitting there going like this. For patients that don't have smartphones, you can hear your hearing aid through Android phones, even flip phones. There are remotes. There's just so many new options that are available for patients. And the sad thing is most patients don't even know these options exist. And so going to a doctor of audiology, getting a comprehensive test, learning about everything that is out there is, very, very valuable information.
So from my own experience with my own parents, I've talked to them, and sometimes I think there might be a little bit of hearing loss going on, but a lot of times they say, oh, you're just mumbling, or you're not talking loud enough, or something like that. So how might an adult child talk to their parent, or have that discussion with their parent that, hey, you might be having some hearing issues? I know this is kind of a sensitive topic a lot of times. How have you had people approach that before, or however they told you they've approached that before?
Well, I counsel a lot of children of patients. And, I mean, the honest truth is if you don't hear well, your social life is the first thing to go, because eating in a restaurant isn't fun. A family, anything isn't fun. Watching TV isn't fun because you're not hearing everything, and it's very frustrating. The sad thing is hearing loss, the patient usually doesn't notice it first. It's somebody else because they've asked them the question 3 times and they haven't responded. And just like anything, if your arm was hurting and swelling and you have those symptoms, you'd go get it checked, or, it's just like anything else. And I just really believe that as a family member, especially like parents, grandparents, like the people you love, like you want them to hear and tell them, we want you to hear, we want you to go to things, participate, stay active. Your ear could be full of wax. You could just have something mild, but at least get it checked out. There's no harm in getting it checked out, and it's non-invasive, and it doesn't even hurt. It's super easy.
Yeah. Awesome. So really just talk to them about it is the biggest thing.
I would just be straight up. I think a lot of times, people in their maybe 70s, 80s, 90s, have that vision of, this big 1970s beige gum thing in their ear, and that's just, not the case. And once people see what they look like and what they can do, and they can hear the difference, that's what it's all about.
Awesome. And I was also, speaking of the hearing aids again, looking at your website, I also noticed that there was an article about hearing aids and preventing dementia, or hearing and dementia being related. Can you talk a little bit about that?
Yes. So people that have untreated hearing loss, there is a lot of research documenting that it leads to cognitive decline. And when you have cognitive decline, that can lead to dementia, auditory processing issues, because if your brain isn't stimulated properly and the brain isn't receiving a good signal, the brain is not going to be able to distinguish it or know what is happening, and then it just increases, atrophy. Think of like wearing a cast for 6 weeks, how that muscle atrophies, and you need physical therapy, or you have surgery. Right. How fast your muscle, atrophies. Your brain can do that too. So you want to keep your brain stimulated. You want to have a good signal. You want to have a clear signal. Not only do you want to be able to hear things, you want to be able to understand them. And when you have a hearing loss, that gets impaired.
That's a great, I've never thought of looking at it that way, as like an atrophy, like a muscle. That's a great way of thinking about that. Weird story. So I had a patient in our clinic for physical therapy, and he was, his family had said something about hearing. His friend had a hearing aid, and he thought, you know what, well, let me just see if I have a hearing issue. So he borrowed his friend's hearing aid. Sounds kind of gross to me, but I guess it happens. So he borrowed it thinking that, if it's just going to amplify the sound, we'll see if this helps. And he said, you know what, I don't need a hearing aid because that made it 10 times worse. I couldn't hear anything really. So is that how a hearing aid works? Is it just amplifying, or is it specifically set? How does that work?
That's an excellent question, because I'm asked that a lot too. So first, your hearing loss is like custom to your specific ears. Your hearing aid, if it is prescribed correctly, is the prescription of what you need to hear better. Just making everything loud doesn't make you hear better. So, if I try on my husband's prescription glasses and I can't see, well, that doesn't mean that I don't need glasses. It just means his don't work for me. Right. So it's really important, A, to have a test, and B, you don't always want to make things loud. Sometimes you want to make certain sounds loud. You want to make certain sounds soft. Amplifying everything is going to create distortion. Nobody wants to hear things distorted. People want to hear things clear. And, the sophistication in all hearing aids now has the ability, to do that. It's not going to make your hearing perfect, but, hearing aids they've come a long way, baby.
Yeah, seems like it. One other thing I wanted to talk about with physical therapy. A lot of times I'll have somebody come into my office and they'll have some balance issues, some vestibular issues, and I talk about the inner ear, and I spend a lot of time telling them what's going on in that inner ear, that's causing some dizziness or whatever it might be. But the response I get back is, well, I don't have a hearing problem, my ears are fine. And I spend a lot of time trying to differentiate how hearing is different than the inner ear and the vestibular system. However, there are a lot of ways that hearing and balance and that mechanism do work together. How can you explain how that does work with hearing and balance and how that might be affected?
Hearing and balance are related because they are the same organ in your head. So you have what's called your inner ear, and that houses your vestibular system. Some people call it your equilibrium, and it also houses your cochlea, which has your hearing portion. So I have a nice little picture. Okay. So here's your inner ear, and this is your inner ear blown up. So this is where your balance issues could be, and this is where hearing difficulties could be. And they're housed in the same organ, and they have pathways that go up to the same brain. So you want to rule out and make sure that there isn't an issue with this, causing that. It's just really good medicine to check the whole organ and make sure, that this part isn't affecting.
So one could be affecting the other.
Exactly.
Sure. Yeah. Awesome. So if anybody wants to get a hold of you, what is the best way of doing that?
Well, the easiest way would probably go to our website, which is geisslerhearing.com, and you will see that we have 3 locations in Hammond, Munster, and Dyer. All our information is on there. We also have a Facebook page, Dr. Geissler's Hearing Center, where you can, read about us, and there's contact information on there as well. Our office offers demos of hearing aids. We offer classes. We offer trials, lots of patient education. All of our classes are free. We really believe in patient education. We take most insurances. Give us a call. We're more than happy to see you, work with you, and hear better so you can live better.
Awesome. Well, if anybody needs to hear better, come see Dr. Geissler. She's an amazing person, amazing doctor, and she'll get you back to hearing well.